Being a new mum is such a fun and rewarding experience, and at times it is exhausting, but it is probably one of the best jobs in the world. But it can be very daunting the first time your baby gets sick, and it's quite hard to know what to do. So it's really important for mums to know how to manage a fever properly. So with this in mind, and to support mums, especially for when their babies are sick, I decided to take the opportunity to seek out some expert advice. And this is for the Nurofen for Children Fever Fighters campaign, and chat to Dr. Sinead Beirne, who is GP and new mum. How are you doing?
I'm good, Lucy. Thanks
You
a
look
million.
great. This is all about fevers and obviously fighting fevers. And even though I've just had my third baby, I'm still unsure as to what actually constitutes a fever, temperature-wise.
Yeah.
So what is the normal temperature a baby's supposed to have?
Do you know, I totally understand that. There's a lot of confusion about it. A normal temperature for a baby is anything in the range between 36 and 36.8 degrees Celsius. That's what we consider normal.
Yeah.
And then a fever is a temperature that's over 37.8 degrees Celsius on more than one consecutive reading. So you check it more than once.
So you're at home then and your baby gets a fever. What exactly do you need to do?
Okay, so if your baby is under 3 months, you need to get them to a doctor if you have identified that they definitely have a temperature. Now, if they're over 3 months, you can treat that very effectively at home. So, you know, the first thing I would do is to strip them off and get them down to their vest. That can even make them feel a lot more comfortable quite quickly. You can also, you know, pop them into a lukewarm bath. So not a hot bath, not a cold bath, but lukewarm, and that's good at bringing down their core temperature. That'll even do quite a good job often. And then just do take them out before they get a bit shivery, because very quickly, as you know, the babies do shiver in a bath, but it can be very effective. And then, you know, there is brilliant medication out there, ibuprofen or paracetamol, to actually bring down the temperature and to help with pain. And I would say, you know, to read the label obviously before you give your child medication to bring down temperature or to help with pain.
Sinead, when a baby's sick, obviously the sleep routine goes out the window for the baby and for the mum. So how can one make life a little bit easier for the baby and the mum?
Like, it's really difficult, Lucy, as you know yourself now, on your third, you're exhausted anyway. You worry when there's a temperature, and it's almost part and parcel, the lack of sleep, the sleep exhaustion when you're a mother. So if they have a temperature, it's going to be out of whack that little bit more. So, you know, it's really important to just treat that temperature. You know, when you've established there is a temperature there, that'll make them feel more comfortable. They're more likely to get a little bit of sleep, and you know, you can rest while they're resting too.
What about then, what do you put your baby in terms of bedclothes? Because you're scared of overheating or them being too cold.
Exactly, like that's a great question, Lucy. What I would say to people is, you know, a sleeping bag, a baby sleeping bag is such a good idea, and one layer of clothing underneath, so something like a vest. So a nappy and a vest and into the sleeping bag, and that way, you know, that keeps them comfortable if they do get a little bit shivery during the night, but also they're not going to overheat that way, and they're more likely to sleep more comfortably at bedtime.
But isn't the room temperature supposed to be 16 to 20 degrees? Yeah,
you're completely right. 16 to 20 degrees is ideal.
It's quite worrying, isn't it, when your baby doesn't feed properly when they have a fever? What's the best thing you can do once they've lost their appetite?
Yeah, do you know, typically they won't be into eating the solids like they used to be. You're really glad when you just get fluids in. So I would say don't worry too much if they're not eating the same amount of solids. That's pretty normal when they're feeling, you know, out of kilter and a little bit off form. So hydration with fluids is much more important. Now, if they're going to eat some solids, let them eat what they're happy to eat, but I wouldn't force or push the issue. And then if they've been vomiting, Lucy, that can be a little trickier, because they get dehydrated really quickly. And when a baby has a temperature, they evaporate water more quickly anyway, so they're more at risk of getting dehydrated. So if they're vomiting, I would say rehydrate really slowly. And what I say to people is if you're watching the TV, you know, for every commercial break, if you can even give a teaspoon of fluid, that can make a huge difference. And ice pops and ice cream, really good as well for getting the temperature down. And of course, when they're vomiting, you can't really get anything in by mouth when that's happening. So a suppository is a great idea, particularly to control temperature or fever, you know, or any pain like that. So,
Sinead, finally then, when should a parent seek advice from their GP?
Okay,
What stage?
so, if your child has a temperature and they're under 3 months, that's a no-brainer. You need to get to the GP and get them investigated. But if they're over 3 months, these fevers can be managed very effectively at home. So, treat it effectively with medication, follow the guidelines on the box, and also then, you might need to look for a little bit more attention if the temperature is staying up, persisting at over 38.5 degrees Celsius, or if that temperature is going on for more than 2 days. It's really at that point that you need to go to the GP and investigate a little bit more. There's certain signs that we don't like to see as a doctor, things we worry a little bit more about, and that would be a spreading rash, a stiff neck. If your child looks at light and they have a reaction to it that they really don't like looking at light, or if they're complaining of a headache, if they're limping with a temperature. Obviously, if they're a toddler, that's again something to be checked out. So, do not be afraid to go and pick up the phone to your GP, even if you're a little bit worried, despite following all the common sense advice. If something tells you you're just not happy, just pick up the phone or go to your GP for that extra bit of support.
Well, there you have it. I hope you enjoyed our chat and you also learned a little bit on how to fight the fever. But in the meantime, enjoy your small people. They grow up so quickly and it's such a special time.